Good day, this is Terry Difazio, and you're watching Dial It Up. Today, my guest is Amy Hornblas. She is a health educator. This is her second time on the show. How are you doing today, Amy?
I'm doing great. Thank you so much for having me, Terry.
I'd like to find out how has your survey progressed since you were here about 6 weeks ago or so?
Yeah, about 6 weeks ago.
Yeah. How has your survey progressed?
Well, thanks to you and some other press that's been covering it, I have been getting some responses, more responses. They continue to roll in. And so I've got some new results I want to share with you from that new batch. And also last time I was here, we didn't really get to go over my fall report. The reason why I contacted you originally was in October I came out with a fall report that included all the survey results from July through October. And so I'd like to cover those.
Okay, sure. Let's take a couple of minutes and do that, yeah.
Yeah, definitely. And so I've been taking those results around to everybody who will listen. So thank you so much. I'm trying to get these results out because I have some very sad news as far as evidence of harms. And I also have some very good news. And the good news is that we keep getting confirmation of what we already know, which is that people who are not exhibiting symptoms are really unlikely to spread the disease at all.
And that's part of the misinformation because we keep being told that even if you're asymptomatic, you can still carry the disease and spread it.
Right.
And you're telling us that that's wrong.
Right. And we'll get to that in a minute. Right.
Good.
The World Health Organization, the CDC, and all the research coming out. It hasn't just been me doing research this year, of course. I'm just an independent citizen scientist doing what I can to gather some evidence, really just to raise awareness about the harms. Mm-hmm. Because it's very concerning to me how many people are being harmed by the use of masks. And we know from 30 years of studies on healthcare providers that there are risks to wearing masks.
Now, there are people, and I'm going to play the advocate's devil here. I'm never the devil's advocate. Okay? They're saying, well, if you're having surgery, surgeons wear masks. That is very different. Can you explain the difference?
Yeah, there are several differences. In fact, in my fall report, I cite a number of these studies. I encourage people to go to vtmasksurvey.com, and they can take the survey. They can read my fall report where I cite these studies. And there are at least two of them that I cite in my report looking at surgeons using masks in surgery. It turns out that the reason why they're using them is not for airborne viruses. It's really just for splashing. It's so that when they're cutting into a body and irrigating and things don't splash on their face, and also so that if they cough or sneeze or something, it'll help catch, even though they might turn their face and catch, it's going to help catch that stuff.
And that's an open wound as opposed to just talking to somebody.
So it's an open wound, so there's a whole different, contamination factor going on. Also, the room has to be kept cool.
Yeah.
So that they don't overheat.
Right.
What these studies are looking at are the effects of the overheating, the effects of the difficulty breathing, and how that can affect their thinking. We know that when our bodies are under this restricted breathing, we get hot, we sweat, our heart rate increases, our respiration increases. I'm approaching this from an evidence-based biological point of view. And so that's what they're looking at in these studies. And they want to maintain that surgeon's comfort so that they can concentrate during surgery. And they also are in a sterile environment already. They're trained in how to wear the mask. They're trained in how to take it off after they leave the room and then wash their hands again. These are things that they are routinely trained in. And even with surgeons, they're worried that the bio risk is greater than the benefit. Mm-hmm. So, people throw that idea out there, but it's a whole different thing. And I really recommend that people do their own research. Please read the studies. please look at what the data says. There really is not any direct or high-quality evidence that masks are effective.
You know what's even funnier? I was just reading this on the net. Dr. Fauci came out with a statement at one point and said that if everyone wore the N95 mask, this thing would be over very soon. So then when he was asked another question about it, he said, well, it may not. So it's like, does it or doesn't it?
Right.
We don't seem to be able to get any straight answers, do we?
We are now. No, we are, because for the whole... When I say that there isn't evidence that masks work, what I mean is in the community setting. You know, they are still researching it in healthcare settings. They're finding, there are studies that find that nurses are more likely to spread influenza when they wear masks. That's why the hygiene is such an important part. So it's still in debate whether it should be used so much in healthcare settings. And even the World Health Organization's latest recommendations are that in healthcare settings, they should only be used in situations where it is likely that there's COVID spreading. Otherwise they shouldn't. This universal use of them in healthcare settings is being questioned by the experts, and certainly in the community setting. That is where we don't have any data, because we've never done this before. But the exciting part is, not only have I been doing my little survey, but people all around the world have been doing research on this for the past year in the community setting. And while the news I have as far as the harms is pretty sad and distressing and extremely concerning. I'm concerned about people's health, their mental health, their social health, and their physical health. But the good news is we also have evidence that they're not beneficial. So if they're causing a lot of harm and they're not beneficial, or we're having a really hard time finding any direct or high-quality evidence, that's the WHO, the World Health Organization's description. It's not high-quality or direct evidence. So if we don't have high-quality or direct evidence that they're useful, and we have all of this mounting infinite harms that could be caused, it's time to do what we should have been doing all along, a benefit risk analysis. If you go to get your knee replaced, you do your own health benefit analysis. You say, well, what's the pain and suffering on either side if I get the surgery, if I don't? What's the cost? How much time do I have to take off? And you weigh that. And then if you find a physician or a healthcare provider who gives you a recommendation that you don't know if that's right, you seek a second opinion.
Yes.
So I feel like it's time for a second opinion, because right now the people who are promoting the use of masks are only concerned about compliance. They're not concerned about whether they're working. They're not concerned about the harms that they are doing. We're doing nothing. There are simple things we could do to address these harms. We could be encouraging breathing breaks. We could be encouraging more sips of water and warning about dehydration. Mask mouth is something that dentists are now concerned about. One article that I have here, it says that the dentist says that half their patients are exhibiting this mask mouth. We're causing all kinds of bacterial and fungal and even ulcers in the mouth and tongue of children, of working people, and people with pre-existing conditions. I'm really worried about those three populations. They're the most vulnerable, and they're being ignored. And if we even bring up the subject right now, people somehow get upset and don't want to hear this. I feel like this is very good news. I believe in health. I want the world to be healthy. I want people to be healthy. And so I feel like the good news is, let's start addressing these harms. Let's start helping people.
It almost seems like this is a top-down approach. And the reason I say that is because even though a lot of these studies are showing that these masks aren't effective and aren't helpful, somehow it's rolled down from maybe the top ends of government or health organizations into scaring enough people so that they're complying. And if you don't comply, they're claiming to take the high road and actually trying to shame you into, you're selfish. You don't care about people. That sort of thing. Have you found that also?
Yes, and that's why I'm so happy to be here with you, because I feel like you definitely care about people. I can tell, because you're quick to smile, you're quick to show empathy, you're quick, to help somebody in need. You care. You're participating in bringing, information to people because you believe that your neighbors are intelligent, and if they have information, they can make the best choices for themselves. And I agree with you on all those fronts. And so you're offering an alternative media. We do have a problem with the mainstream media and television, Facebook, social media. There is this promoting this idea of believe the science.
And that's what a lot of these people that are trying to shame you are saying, well, that's what the science says. But it's a matter of what science are you choosing to look at. Almost anybody can quote a bunch of figures and say figures don't lie. However, liars do figure.
Right.
You know?
And mathematical models are wild guesses. They're based on what you put into the model, and that's what a lot of this is based on, either mathematical models, they're based on studies of people who were living in common areas, so they had surface contacts, and that's how we know that viruses and things spread, is by, through the surfaces. And so, the evidence is perfectly clear. When people say believe the science, that is the most unscientific statement you could make, because scientists don't believe anything. Scientists make hypotheses, and then they test them. They try to prove them wrong. Right. They try to prove them right. They say, well, if this was true, then this would also be true. And they go and look for that information, and they follow it, and they tweak the hypothesis as they go along.
Well, this is another thing, too. When you have scientific theory, that's different than a normal theory, in that a scientific theory is something that's usually proven already. You end up with, like you said, you start with a hypothesis, and then you have to prove it or disprove it.
Yeah. One
way or another. So remember, gravity was a theory once.
Yes.
So now you have Newton's theory of gravity, and it's been proven. So scientific theory is something that is usually proven. Or it's discarded as not being proven,
and it's still being tweaked.
It definitely is.
Yes.
So, what has been the general reaction to people that have taken your survey so far?
Yeah, so I'm getting a lot of gratitude. People are really thankful. People who take the survey, people who hear about the survey. I am really concerned about the people's voices being drowned in this whole believe the science, just wear the mask. It's better than killing people. And if the opposite is true, it's very frightening. So here are some of the results that I'm getting. Of course, difficulty breathing is not surprising. It was one of the top complaints. People who have these difficulties, these 7 difficulties I asked folks about, people who have difficulties every time they wear their mask tend to have 3 or more different kinds of difficulties. So it may be perfectly true that one person is having no difficulties at all, and the person next to them is suffering greatly. And these are not anything to joke about. Difficulty breathing, I don't know when before this year you would have gone to your doctor and said, whenever I do this one thing, I have difficulty breathing, I can't catch my breath. Would your doctor say, oh, keep doing that thing? Why don't you do that 8 hours a day and stop complaining? I'm tired of hearing this.
Sometimes the doctor will say, stop doing it.
Right, that is right. Let's find a way that you can stop. Right, because difficulty breathing, and it makes perfect sense. And the research of healthcare providers shows that an N95 mask restricts your breathing by 37%. Restricts it. So, it's like so. I don't know if that's the same as cutting out 1 out of every 3 breaths. But if you think of, restricting your breathing by about 1/3, we have no idea what these cloth masks, that's still being researched, how much that restricts the breathing. It could be more than 37, it could be less, but I'm using 37 like 1/3 as a judge because it's probably right around there. So we're restricting breathing by 1/3. When they test underneath the masks, and I have studies from before this year of healthcare providers cited in my fall report, we've been studying this for a long time, that oxygen level under that mask is below OSHA standards, and the CO2 level is above. And that makes sense, because as you're breathing in and out, you're not able to get fresh air. Now, OSHA's answer to this is that the OSHA standards apply to the room, the ambient air in the room, not under the mask. So that's how they've gotten, how they've positioned themselves to not have to take this issue on. But it's a serious issue. So under the mask, there's not enough fresh air. And so difficulty breathing, especially for people who have pre-existing conditions, like, say, asthma. About 1 in 10 Vermonters, children and adults, have asthma. people should have an exemption from wearing a mask if they have asthma. Our state mandate, mask mandate says that. It's not being honored.
Well, for one thing, you have a private business, and they can say, oh, you have an exemption, but we don't have to serve you. Right. And that is true. That is the law. They don't have to serve you. And I find that very frightening in a lot of ways. I think that it's almost like, I think Ben Franklin once said, if you give up liberty for security, you'll probably end up losing both.
Right. So now we've got people who have asthma. That's 1 in 10. Then we have COPD. How many people have that? Plus a lot of anxiety issues, wearing the mask. Anytime someone feels that restriction, if they have had issues in the past, maybe with suffocation or strangulation, or seeing somebody go through that, or watching somebody die with COPD. These are things that once your breathing becomes constricted, your body naturally panics, whether you have a trauma or abuse history or not. Your body says, oh, wait a minute, like this is a crisis. Because what's happening is, while we can test your oxygen levels, and people will reassure you all the time, well, your oxygen levels don't drop when you're wearing a mask. Well, I have a couple qualifiers for that. First of all, that's if you're not pregnant. We know from a study that I cite of pregnant nurses that when they wear a mask, their oxygen levels in their blood noticeably drop. So what's happening is, if we're not able to get enough oxygen in when we breathe, and we're not allowed to breathe out the CO2, which can become a real problem, health problem in our bodies if that builds up, cause brain damage and all kinds of issues. If we can't have that exchange happen, our body is going to struggle to maintain the proper blood levels that we need. But where are we stealing that oxygen from? From our organs. And that's why we can't really tell right now what kind of long-term damage we may be doing. And that's why these studies of healthcare providers have been going on for 30 years, because there's a concern there. What's going on here? Where is that being taken from? And we can see with pregnant healthcare workers that body, that pregnant woman's body is not going to starve that baby of oxygen. So where is it going to steal it from? The mother. So you see, like, our bodies will prioritize where do we need to put that oxygen, but there's a limited amount. So that means something's being starved. Right. Something's being, and so that is very serious. And I find it concerning when people poo-poo this difficulty breathing. It's probably one of the biggest concerns. And then one of the other things I also found high levels of in the survey was difficulty cleaning your hands every time you touch your mask. And we can watch our officials go into press conferences and take their masks off with unclean hands, put them back on with unclean hands, put them on the desk. This is a contamination issue. In healthcare settings where they've used masks, for protection, they have to use proper hand hygiene. They have to change that mask every time they go in and out of a room.
Do you think it's possible that the mask manufacturers are making a lot of money on this?
Oh, yes, there's big profit. Oh, yeah.
I don't like to be a conspiracy theorist, but this all seems to be very fishy.
Right. Well, the World Health Organization lists in their June report that I cite in my report, they list what the potential harms could be, and that's where I got my list of potential harms. And then they list the potential benefits, which are very limited based on science. And one of the 6 benefits, besides an increased sense of security, somehow it's supposed to make you feel better, right?
A sense of security, not
and
actual
profit
security.
For mask making. It's like, well, I'd rather profit from making people healthy. And if you read the box on the mask, I've seen a box of masks that says, if you have difficulty breathing, remove the mask. This
is an interesting thing. I was watching something the other day, and they're telling people you have to wear a mask, and you have to socially distance, and you have to quarantine and do all of these things. However, has anybody ever told, say, a heavy smoker to stop it?
Yeah.
I'll give you an example. In 1985, I was in the hospital with a kidney stone, and I had to have it extracted. My roommate was a 75-year-old man who was in there getting his lungs cleaned out, and he was smoking a cigarette in the room with me. Did anybody tell him, we're not going to help you if you don't stop smoking?
Right.
But now they're mandating masks and social distancing and all these restrictions, and I'm finding this a bit baffling.
Right. I mean, I believe in community health. That's my field. I want to make people healthier in all senses, right? And so I've been addressing tobacco for a long time, and it's the leading cause of preventable death. And right now, with the shutdowns and the loneliness and the poverty, when we know that when people are under economic stress, they smoke more. Smoking is doubling. So is all addictions.
They drink more, and they do other drugs more. Right. That's a common thing.
And nobody says anything if you take your mask off to smoke.
Yeah.
Right? Or to talk if you're in a press conference, because we know that difficulty communicating is real. It's super real. When you when you have that mask on, it is really difficult to hear what other people are saying, to speak and understand, to communicate. And so, we know this. So it's also breaking down our society. There are social problems,
Definitely.
and I have lots of evidence about all of that.
The last time I went to Dartmouth-Hitchcock Medical Center for a checkup, my doctor and all of his nurses, every time somebody came in the room with me, they not only had a mask on, they had a face shield with it. And I'm saying, what are you saying? I can't even hear you.
Right.
So they lift up their mask, or their shield, and then they talk and say, well, that was easy enough, wasn't it?
Right.
And it's getting to the point where, I'm going to ask you a direct question, because I've had my opinion about this for a long time. Do you feel that we, as a society, are becoming more and more misophobic?
Can you define misophobic? Is that
fear of germs?
Fear of germs, yes. Yes. And I'm really worried about, how the concept of this virus is affecting people. I mean, especially children who are growing up right now, but adults too. I find it really surprising that people don't understand the size of a virus, how difficult, how many virus particles you'd need to become infected. There are a lot of really gross misunderstandings. I mean, gross like in the big big misunderstandings.
Oh, definitely.
That are going on right now that I don't know if we're ever going to be able to change. I mean, I want to come here with a really positive note, because I have good news, that we can prevent these harms. It is doable. It's easier than getting people to quit smoking, I mean, all we have to do is get them to look at the evidence.
I think part of this big problem goes even further than what your research shows, and that is it's the general media that seems to be feeding this frenzy. And what I'll cite is, here in Orleans County, there was one death from COVID. It was all over the papers. It was front page news.
Yeah.
The person was, I believe, over 90 and had several really bad healthcare issues already. In my opinion, probably a cold or anything would have probably killed this person. But it was all over. First COVID death in Orleans County. But the person was very sick anyway. Right.
So I'm really worried, because we as a society have sort of agreed that we want to protect vulnerable people. That's the reasoning given for everything we're doing. Yet, if we are hurting people more who have pre-existing conditions, who are suffering most under these masks, if we are hurting children most under these masks, and like you said, when you went to the hospital and it was hard to communicate with your physician, that is one of the problems. We know, I've got the statistics here, I think it's about 140,000 people roughly, let me see, I've got it right here, die of let's see here, medical errors in the United States, people who shouldn't have died because they were seeking medical treatment, but the medical treatment went wrong because people make mistakes.
That's
Healthcare
right.
providers make mistakes. I mean, so we know that this happens. 250,000 people a year die in our country from that before COVID. And how many prescription drug errors caused that? How many deaths? 128,000 deaths. So what is that? 375,000 deaths just from medical errors before COVID. Now, if we know that these masks and this PPE and even the gloves, the World Health Organization is saying, please, healthcare providers, take off those gloves whenever you can. I mean, that's going to make it harder to do your work, to hear your patient, to connect with your patient, to see your patient's face and know if they are okay. So much, it's hard enough to speak up when you're at your healthcare provider, but then when they can't even see your face to know if you're all right. And then they are removed from you. And so you have that depersonalization, you've got the encumberment of the gloves. I mean, a lot of those medical errors are when they do catheters. And so can you imagine trying to do something as sensitive and routine as a catheter? through all of this stuff. I mean, could it be? I mean, I really want to do, I feel like we could be doing this research. This data is out there. Could we be causing more medical errors because of this PPE? There are so many infinite questions and so many infinite directions that we could be causing harm, and we are gathering evidence of that.
Well, it's become doing social harm.
Yes.
People aren't talking to each other. People are angry with each other.
Right.
I mean, if for example, if I choose whether to get this vaccine or not, it should be my choice. And people who are for this vaccine are saying, if you don't get the vaccine, you're a bad person. And the people who are against the vaccine are saying things like, oh, it's all these risks and risks and risks. It's still my choice.
Right.
And this is what I think is happening. We're losing that sense of it. And I'm very, very afraid that we are becoming so misophobic that we're afraid of any little germ that comes along. If, in my opinion, all of these viruses run their course, no matter what we do. We may have prolonged it to sit, and we're really not going to save any more lives than what we normally will. We'll just prolong it. And
we could be creating new super germs too through this. Mm-hmm. So it's sort of like it's taken the germ theory and put it on its head. I mean, now we have these petri dishes on our faces that we're touching all the time that are gathering viruses and bacteria, and we're breathing them back in because we have the mask on while our bodies are trying to breathe them out. We're touching things, and then we're passing them around, and then they're touching it. And so we're creating, kind of superbugs that way. We are also, by being isolated and not traveling. I mean, remember that when people from the West came to this continent and first met the Native Americans, they brought their germs. These were foreign germs that the Native Americans didn't have a resistance to, and that caused genocide. Not purposeful genocide. But it killed. I don't know, a lot of people.
Oh yes, it did.
And so we're by isolating, by not traveling, by not mixing, by not keeping our bodies strong and in contact with these germs and bacteria. We could be creating a superstorm. I mean, what we're doing, I'm really interested in healing and health, and it seems like everything we're being asked to do in response to this virus is unhealthy. Oh,
it's very much so. I agree. Can we have your contact information? Do you have a website or an email?
Yep. It's VT, like Vermont, VTmasksurvey.com. And if you go to that website, you can take the survey, you can read the fall report, which has a lot of sources cited. And I'm going to be working on a spring report that I'm going to be coming out within a couple of months, too.
Do you have an email or a phone contact or anything you want to give?
Yeah, so the email is vtmasksurvey@mail.com. Kept it as simple as possible.
Yeah, I agree that that's probably the good thing. And I am hoping that you will come back again and we will report on your progress, because I think this is a very important thing. I want to thank you very much for coming, Amy.
Thank you so much, Terry.
This is Terry Difazio for Dial It Up, saying we've had a heck of a good person on our show today, and we hope you enjoy it. Until the next time, we'll see ya.